Good evening, everyone. Thank you so much for joining us. Welcome to the My Horse University and the Extension Horse Quest live webcast titled Equine Emergency First Aid. This webcast is completing our horse health series, but if you have missed any of these webcasts, you can see them on our website at myhorseuniversity.com. Our presenter tonight is Dr. Judith Marteniuk, an associate professor in equine medicine and extension at the Large Animal Clinical Sciences Department at Michigan State University. Originally from Canada, Judy received her DVM in 1975 at Western College of Veterinary Medicine, the University of Saskatchewan, Canada. In 1984, she specialized in animal nutrition and received her MS at Michigan State University. She educates our veterinary students as well as working directly with clients and their horses. As most of you have already discovered, you can ask questions during the presentation using the text chat to the left of your screen, and our questions tonight will be facilitated by Dr. Eric Schroeder, a resident at MSU's College of Veterinary Medicine. Our presentation this evening will be recorded and uploaded to our website if you would like to review it at a later date. And at this time, I will turn our presentation over to Dr. Marteniuk.
Okay, thank you, and hopefully, make sure that you can hear. If not, please let us know. And the other thing, since there were a number of people that were, attending this tonight, and if you're willing, I'm willing, and I will stay after and answer questions along with Dr. Schroeder as he types away at your questions as we go through this talk. So, hopefully you find this informative. And as we, get started here, knowing when an emergency is going to happen is very important. And typically, we're going to spend more time, or I should say an equal amount of time, in recognizing some of these things and trying to figure out how to prevent them is actually, talking about treating them, because there are so many emergencies we could not give justice to this in, an hour, time slot. So one of the things, if you own horses, it's just an inherent part of having them that you're going to have emergencies. And like anything else, if we try to maintain a safe environment for these animals, we're going to diminish our emergencies and potentially diminish the severity. But they are going to occur, so be prepared. And, be educated about different types of emergencies, when you should call, when it might be able to wait a little bit, as well as, we're going to talk about assessing the situation, trying to figure out what, the concern is, and, do I need to act immediately, or can I monitor the situation for a period of time? And above all, knowing horses are extremely good at reading body language. It's really important for both your safety and your horse's safety and everybody else around to remain calm. There have been studies that have shown horses will react to a person anticipating something happen. There was a study where people walked around an arena, and then they, had their heart rate and their horse's heart rate monitored. The next time they went around, they were told that somebody might pop out at a certain area. Nothing ever happened, but the people's heart rate went up, and so subsequently did the horse's heart rate. So they're extremely, good at reading body language. So it's, behooves us to be very calm, during that period of time when we're, working with these horses. And prevention is extremely important. Keep up on your preventive care. Make sure you do your deworming, your parasite control, which is changing dramatically now. Make sure we spend time and that our horses' teeth are in adequate condition, especially those of us that live in northern hemispheres, paying attention to body condition, primarily in the winter when we may not be able to see it as readily because of a hair coat or a blanket, making sure our horses aren't losing weight, during the winter, making sure we keep up on foot care, during that period of time. Also, have a regular veterinarian that you can call on. Many veterinarians may not come if you only call them for an emergency. And not alone may they not come, they will have a harder time potentially finding your place, especially if you're one of those people that, are difficult to find, you live on a back road or something along that line. So have a good working relationship with your veterinarian. That will also help when you're trying to decide if something is an emergency or not, because you feel comfortable calling them and discussing the situation with them, and they know your animals, your abilities, and it just makes for a much better, situation. Along with, the preventive care is making sure you have good housing and fencing. And that will vary on the type of animal you have. If you have young foals, the fencing has to be extremely secure and extremely safe. For an older, mature gelding, as we see with these little Hoflingers here, you can have, a series of electric wires and not have to worry about them running through. They know what fences are. They're, very comfortable in this type of setting. The other thing we want to do is to maintain those facilities. It's really hard to, think, well, gosh, when was the last time I inspected that stall for any, nails or anything? When did I walk my fence line last to make sure everything is appropriate? And one of the farms that I took students to teaching, what they did was, they went ahead and actually on the calendar wrote down that at a certain, time of the month they would inspect stalls or inspect pastures or what have you. So routinely, those things didn't get kind of pushed to the back burners, during that, period of time. We did mention body score, extremely important. We want to, be aware and try to keep our horses in a body score of, 5 or 6 over a 9-point scale. This is going to be a healthy horse. Make sure your feed is secure, preventing horses from getting in and getting grain overload. So make sure that they can't get into the feed room. And on that line, make sure that you have safe feed, that it isn't spoiled, that the storage is appropriate. If you live in an area like Michigan where we have tremendous amount of sand colic's an issue, and we don't want to be feeding on the ground, as we see these guys, because the likelihood is along with their hay, they're picking up a considerable amount of sand and potentially parasites, as well. Along with, being prepared is keeping your veterinarian's phone number and maybe a backup veterinarian by the phone, by the stall, with, the area or the barn manager. And it's important to have these by a phone in a barn or by a stall, because I might be driving by and see your horse in a difficult situation. And if I come into your barn as a horse owner, I may not know the area at all and who the veterinarians even are in the area. And it's much quicker for me to just go to the phone and see the numbers there, or read it off your horse's stall, take my cell phone if I have one, and give the veterinarian a call or give you a call. So it's important that information is in places where you wouldn't think, well, I know that, why do I need to worry about it? But the person that discovers the emergency may not know that information. Fire department, all of those things should be readily accessible. And if you're traveling, it's important as well to make sure you locate potential veterinarians during that travel, or when you're out on a trail ride in an area, because accidents happen, and it's nice to know who you can contact and not have to be trying to do that under a stressful situation. Also, knowing where your referral hospitals are. If this animal needs to go past the care your local veterinarian can give, where do I take this horse if it needs colic surgery or potentially a lameness workup or repair of a fracture? And then how do I get that horse there? Do you have your own truck and trailer? If you do, along with that fence and stall and whatever, checklist, it's nice to make sure that your trailer is, functional. Again, if you're in northern climates, you might be snowed in, making sure your tires stay, used. If you're like me that, uses my trailer rarely, tires could get, deflated and I might not even know it. So it's important that I keep those checked to make sure, what's going on, and that my truck is in working, condition. And if you don't have a truck and trailer, know how you can get one in a timely manner. Have it checked out ahead of time. Do I rent one? Do I borrow one? What happens if it's Christmas Day? Because Murphy's Law says emergencies occur when you least expect them. And then what happens if we have natural disasters, floods, fires, earthquakes? It seems like this year has been particularly bad, for natural disasters. So what happens in those situations? Are you prepared for that kind of a situation? Along with being prepared is having sometimes moral support. They may need, some help loading your horse, especially in a stressful situation. Having somebody just to ride along with you, or maybe potentially drive, because it's going to be safer for them driving than you at that point in time. And they may be able to help you make your decisions, considering that they aren't as emotionally attached. And even us as veterinarians, we are not any different than the rest of you when it comes down to our own animals. We need some help from somebody else on occasion to make a correct decision, both for us and our horses. And you want to think about these things ahead of time. Make sure that if your horse were to need some of these things, colic surgery, if it broke a leg and it was something that was repairable, if your mare was foaling and had trouble and needed surgery, what am I willing to do for my animals? What's fair to the animal? What's fair to me? And things might change when that happens. But if you've thought about it ahead of time, it's much easier to make a decision than not having even thought about it, at all. And Murphy's Law says that, the less prepared you are, the more likely you are to have an emergency. So really, think about some of these aspects, like this little guy here that was born and had some contracted tendons and, needed some, medical support. He's going to, recover fairly nicely, but you need to think about some of these aspects because they may not be cheap, even, when they're, readily, have a good outcome. Think about both, what's best for you economically and what's best for your horse, and it is an individual decision. Along with that, make sure you have a first aid kit handy. And it allows you to quickly, address a problem. I need something to control bleeding. I need to be able to, grab a wire cutter if my horse is, trapped in wire, what have you. It gives you that sense of security. You're not running around trying to find something when it can be right in front of you. And because you're stressed enough, you just don't see it, right there. And it's going to be a little bit variant from farm to farm, and also by where your emergency kit is. If you have the one for the barn, that's potentially going to be much more extensive because you don't have to carry it around. You're going to have it there. You can have a lot of supplies in it. If you're out trail riding, you're going to have less supplies, but you want to be able to address, certain situations that might occur out on the trail. A lot of times they might be injury related versus maybe colic or something else, although you may have some of that occurring as well. Waterproof, so you don't get dampness in it. So a bag like this would not be something you'd want to have in the barn. This would be fine if you had it in your house and you ran to the house and got it, but probably not something I'd want to put in the barn because it's also not rodent proof. And no matter how hard we try, mice and rats are going to get into rooms. This is a first aid kit that was put together as a suggestion by the American Association of Equine Practitioners on the My Horse Matters, website, and goes through essentially bandaging material, having something sharp, scissors-wise to cut, some hemostats to, control bleeding if you have an artery that's spurting, although pressure is going to do that. A digital thermometer, and we'll talk about this a little bit later too. Better to have one of, the digital ones than the mercury, both for speed of reading and also for breakage and mercury in the environment. Some type of an antiseptic scrub. And containers, flashlights. Make sure you check your batteries, because that's another thing that's going to go bad is your battery sitting in your first aid kit until you need to use them, and then it may not work. And you have some of the wind up flashlights and things that are available now too that may be of benefit. Something for splinting, you might have in that area as well. Fly spray may or may not, depending upon where you live, but things to be able to, look at the feet. And then it's, stethoscopes are, quite cheap for a stethoscope that's going to allow you to listen to the heart and the intestinal tract. They don't have to be a high quality stethoscope for this. Other things that you may want to have, in this kit, you may want to have a twitch, but that may just be in the barn. Duct tape is, good for everything. And so, having that available. We talked about, potentially wire cutters, some rope if we need it. And when you look at bandaging material, it's nice to have all the fencing bandaging material, but some of the things like diapers and sanitary napkins and things along that line make very good absorbent material for, a bandage that's going to be quick. The other thing is, again, if you live in areas like Michigan, we have winter. And so we want to make sure that if we have any drugs in there that are going to be affected by freezing, that they're no longer in that, and they may move into the house for a period of time when, winter is upon us. And remember that if you're going to use drugs, check with your veterinarian first. All drugs have side effects, no matter what they are. And we only use them when the good effects of that drug outweigh the bad effects. And having that relationship with your veterinarian is really important, so you can call them up and say, hey, I have this, and what do you think, and should I give them a certain drug, and how much do you think I should give them? Your veterinarian, knowing your horse, is going to be able to help you in that situation. And a lot of times they may have you give some butanbanamine if you have that on hand for something. There are tranquilizers out there that are sometimes prescribed as well, but be very careful with these in the fact that they can have some very severe consequences for both humans and horses from a safety manner, especially if given inappropriately during that period of time. And we don't want to have anybody getting inappropriately hurt. So if, and I'm assuming the majority of you will have, I was just reading the thing as far as, taking calls. If you have an adult horse, and I'm assuming the majority of you will have adult horses, it's important to know what's normal for your horse in a certain situation. Not, if you have him out on the trail, his behavior may be totally different than if he's at home, in a box stall. So know what's normal when he's in that type of situation, so you know if he's acting abnormally. Know what his normal water and appetite are. And one of the things that our students learn immensely is we're continuously asking them, what did they eat? What did they drink? How much did they pass overnight? And what did it look like? Because we can tell an awful lot from these parameters how that horse is acting. And is he urinating as well? Know what's normal. Feel his legs. Know what's normal. It's nice to have one pair of each, so you can tell if one feels different than the other. And know if your horse is likely to be laying down in a situation or standing to determine what's going on. And so be very observant of your horse. The other thing is, along the same lines as being observant, you want to be extremely in tune to your own instincts. If it, feels like something isn't quite right, it probably isn't quite right. And so go ahead and, start looking closer, call your veterinarian, because if your gut feeling says something is wrong, then it probably is. And these are kind of normal parameters you'd expect. For a horse, its temperature in an adult horse is going to be somewhere typically between 99 and 101. Done again with a rectal thermometer. We talked about the digital versus the, the old glass. But remember that if it's extremely warm out, you have a dark colored horse, they've been in the sun, it may be a little warmer. If they've been exercising, again, exercise is going to increase body temperature. And so it's important to take these things into consideration when you take your horse's temperature. Their heart rate or their pulse, again, is going to be, for a really fit horse, down in the high 20s. For the majority of horses, if they're not extremely fit, we're going to see horses with a heart rate in the mid 40s. And you can listen over the heart and get that with a stethoscope, or you can feel, their, pulse down in their lower leg, just above their fetlock, or at their fetlock area. You can actually feel a little artery underneath their jaw, or you can kind of feel it at kind of the corner of their eye. And so figuring out what that heart rate is, and practice these things ahead of time so you know that you can find them in a non-stressful situation. The other thing is respiration. An animal that's in pain or stressed, their heart rate's going to go up, and so is their respiration. But it will also go up with excitement, again with temperature, when it's hot and humid out just like us, your respiratory rate's going to go up, and depending upon what their fitness level is, their respiration is going to be higher. We want to go ahead past looking at the basic monitor and look at their mucous membranes. We want to have a horse that has nice pink mucous membranes that if you press just above their teeth, you're going to be able to have that color come back rather quickly during that period of time without any problem, as seen in the picture just above the person taking the horse's heart rate. Those are normal mucous membranes. They're not a problem with this horse. They're nice and pink. Whereas if you look at the top two pictures, these mucous membranes are kind of dark bluish color. You press on them and the color does not come up very easily. It stays blanched. These horses are in trouble. Intestinal sounds, they should be present on both sides of the horse. Typically we're going to listen in 4 areas, kind of high and low on each side of the abdomen. And you can listen with your stethoscope, or you can actually even hear these with your ear, which is not that difficult in a normal horse. If you hear a lot of fluid sounds that sounds like water being poured back and forth, that's not normal. Neither is it being extremely quiet. So you can do all these things and try to get an idea of what's happening before you even call your veterinarian, unless you have some really extreme questions you need to ask immediately. And as we stated before, don't panic. Remain calm. The calmer you are, the quieter your voice, your horse is going to trust you, and they're going to relax as well as everybody else. And 99 times out of 100, taking that, and I'm not talking about taking hours to try and assess your horse, taking that extra minute or two to try and figure out what's going on. You look at their mucous membranes, you take a quick feel of their pulse or their heart rate, count their respirations. It's not going to take that long, and you're going to get a lot more important information that your veterinarian is going to be able to help you to try and determine if this is an emergency or not in this situation. And with this information, you collect as much as you can, but don't jeopardize your safety. Horses are big, strong animals, and especially when they're in pain, they may be extremely unpredictable. So if it is dangerous to collect this, don't jeopardize your safety or anybody else's safety around that horse. Do things only if it's safe. And then after you've collected that information, you want to know, is this normal for this horse? Is he acting okay after I kind of really took a look at him? And I can watch a little while longer? Am I concerned and I need to come back and check again? Or is it at a situation where I really need my veterinarian's help? So there are some things that if you can, before your veterinarian comes, if you have a situation where you have some type of a laceration, as we see on this horse's leg on the far right, we're going to want to control the bleeding. And the best way to control bleeding, as we'll talk about, is with pressure. So either hand pressure, but typically we're going to put some type of wrap on this to control. And as we put a wrap on this, if we have bleeding coming through the wrap, don't take the wrap off and place another one. Just re-wrap over top of it and keep building up that bandage to try and provide enough pressure to control bleeding. If it's an area you can't bandage, you're going to have to use your hand and some towels or something to maintain pressure. If it's a spurting vessel that you can actually see, your hemostats from your first aid kit may help you in controlling bleeding from an artery that's bleeding. If you have the ability, you're going to try and find these animals to a quiet, safe place. However, if you have an animal like this racehorse that may have fractured its leg on the track, it may not be safe to move them at that period of time until you have an ability to get the horse off or out of the situation. Just try to keep them as calm as you possibly can. And remember, anytime you have questions that you're not quite sure of, call your veterinarian. Have them help you make some of those decisions, even if it's during the assessment of the animal. what do I look for in my horse, that it might be signs of pain or a problem occurring? Well, if we're dealing with a colicky horse, a lot of times they may just be restless, they may be pawing, they may be pacing, but that might be, happening too if your horse, is just stressed for some type of, situations. If they're rolling and thrashing, that's not typical behavior. It starts to move into, definitely, sure this horse is colicking. Change in attitude. Lack of interaction with other horses. It's typically up with the group and now it's kind of back in the back 40 and doesn't want to interact either with you or the other horses. Something is going on. You need to be paying attention. Sweating when it hasn't been exercising or it hasn't been extremely hot may be a sign of pain and needing further attention along that line. What's the heart rate, respiratory rate, temperature? Are they in line with what the horse has been doing and the environment, or are they abnormally high? Oh, in some situations, are they low as in temperature if you have an animal that is down and unable to rise and it's in a cold climate? And if you have a horse that is having issues, try to avoid moving that area if at all possible. So if something is hurting, just allow that horse to be quiet during that period of time and try to get help to the horse, rather than if you think it has a fracture, trying to move it out of an area. See if you can get a trailer and things to that area, have your veterinarian come and help splint that leg, bring in help before it's moved. So what things are emergencies? And we're going to go through a few emergencies, a little bit of detail because we don't have an adequate amount of time. It takes hours to go through all of these. Choke, if it hasn't resolved within an hour, we're going to be wanting to spend some effort to try and have somebody look at this animal. Sudden behavior changes where their attitude is more depressed, more excitatory, they're seizuring, anything in behavior change. And remember along this line that an aggressive behavior, especially, although so, can an animal that is extremely quiet, always start to think that if we have neurological signs or extreme behavior signs, that rabies has to be on the differential, especially when these horses are not vaccinated. And rabies is what the American Association of Equine Practitioners considers one of the core vaccines that all horses in North America should receive. So keep rabies in the back of your mind, especially if this horse is not vaccinated. Colic, and we're going to talk about that a little bit more. Anything, where you have extreme, bleeding from arteries, major veins like your jugular, you don't have much time, an extreme nosebleed, anything that doesn't stop readily needs to be considered an emergency. Eyes, can deteriorate very, very quickly. If you have really severe tearing, they're tightly closed, you can't get a look at it, you have, eyes and lacerations, those are always an emergency. If your horse ties up, depending upon the severity, maybe, a real emergency. HYPP, if they're having an episode where the horse actually goes down. Heat exhaustion, if you have some respiratory issues where you have labored breathing, they may have reacted to an injection or something along that line, an emergency that we need to deal with at that moment in time. Anything in the lameness category that occurs quickly, and if there's any indication that it might be a fracture, if it's laminitis, and laminitis is just a fancy word for founder, any injury that's near, over, or in a joint is definitely an emergency at that point in time, because if we don't get that in an early enough period of time, there may be enough damage occur to that joint that we can no longer have a sound horse, even with all the treatment that we can provide for it once we're called. Where does it go from emergency to urgent, that we need to get there and do something but maybe not quite as quick? If you've had a colic that's been mildly discomforted for a period of time, it's just not eating the way it should, maybe a little bit of decreased manure production, or you've used some pain meds and it kind of didn't quite make it right, it needs to be seen in a timely manner, but it, needs to, be a period of, time that is not a downright rush. Bleeding, small amounts of blood, you have a cut full thickness, you have some punctures, but they're not over a joint. Those need to be, seen, but it isn't, a down outright emergency at that moment in time, but you need to get them seen that day. Any behavior changes that aren't extreme, warrant attention. But if the horse is relatively stable, it might be able to wait for a little bit. Same thing with respiratory, that if it's not extreme, the horse is still, willing to eat. Those are not as, severe. Lameness, again, if it's gradual, not a big issue as a rule that you need immediate attention. But if it has sudden onset, make sure, this is an emergency. It needs to be seen now. And eyes, if it just looks slightly off, maybe, waiting a little bit, but to me, eyes are always an emergency because they only have two, and, blindness is, something that is very hard to reverse depending upon the situation. Grain overloads, extremely important. If a horse got into a large amount of grain that it's not used to it, that's an emergency. If they've just overeaten a little more of their ration, it may be able to wait, but again, need to see it. And, diarrheas. And I have some pictures coming up where if it's just loose and the horse is not dehydrating, again, you have a little bit of time if this is an adult. But if it's, basically fire hose diarrhea, you're going to need to, go ahead and, have that animal seen, in a, timely manner. So colic, one that kind of strikes dread into, everybody as to, what am I going to do when this happens? If your horse is lying quietly, just let them lay there. If it's safe for you to get in, to check their color, to check their heart rate, their temperature, their gut sounds, it's going to help your veterinarian, make the decision of, are you an emergency, or can you get that other emergency before he comes and sees your animal? If they are rolling, then you can go ahead and walk them, try to keep them from hurting themselves. But incessantly walking a horse that's willing to lie quietly is not necessary. Make sure that if you do happen to give any medication, pain medication like butyrbandamine, that you then take away their feed. Because once you give them the pain medication, if it works and stops the pain, this horse is now going to want to eat. And you may not have removed the problem. You've just removed the pain. So until, we're sure the problem is fixed, don't leave your horse with, grain and hay in front of it. None of us are going to starve in a short period of time. They can have their water, but make sure they don't have feed until you're pretty well comfortable that whatever the inciting cause is has passed, or the pain medications have worn off sufficiently that now, this horse is not in a situation where he's going to make the situation worse by eating. Lacerations, another one where, we see a laceration like this, and the first thing we think we got to do is we got to put something on it. Don't, pick at wounds. You can run a hose lightly over it, wash dirt out of it. The cold hose is going to minimize, the swelling that occurs until the veterinarian can get there. But don't be blasting water into it. Don't put medication on it. Don't put your favorite color of ointment or spray on it, because that is going to limit the ability of the veterinarian to suture this wound. First of all, we need a clean wound that's been, washed and prepared for suturing. But if it has any spray or ointment or things on it, that's going to limit our ability to suture it. And the quicker we can suture a wound, the better chance we have of it healing. It's called the golden rule. If you can get there within a few hours of the wound happening, it has a much better chance of healing than if we, end up trying to suture this wound when it's older. The only place where this does not apply is the head. The head has such a really, really good blood supply that most wounds on the head can be sutured, and most of them will have a successful outcome, even if it has been a bit of time. And that goes for eye lacerations. Even if it looks like a very minor eyelid wound, call your veterinarian, because there's such a good blood supply that we may be able to preserve that small amount of tissue that forms the eyelid without having the horse then lack some of the ability to blink and those aspects and protect its eye. So head wounds, the golden rule doesn't really apply because it has such a good blood supply. But every wound we want to try and get treatment as quick as we can to try and give it the best chance of healing. What do we do if you come out and you pick up your horse's foot and there's a nail sticking in the bottom of the frog? If you can, and this may not always be possible, but if you can, it's really important to try and leave that object there. In the foot, one of the important things of leaving the object there is knowing how deep it went and where it might have penetrated, because once we pull that nail out of the foot, it's extremely hard to figure out where it went. Now, above all, we have to make sure that that object doesn't get pushed deeper into the foot. So if that object is getting pushed deeper into the foot, then it's important that we remove it if we can't put some type of bandage or support on it to keep it from getting pushed deeper. Now, we've had horses come in that have had fence posts and things through varying parts of their body or other things, and you've all heard about people that have lived through getting metal rods pushed through their chest and those aspects. If you have something buried deep in a tissue, leave that there until your veterinarian comes, and sometimes it may be left there until it's actually referred to a referral hospital, because when you remove that object you may have bleeding that you can't control, and to remove that object, you want to have the best chance of survival for your horse is being in a situation where there's an IV catheter, there's blood available, all of these things. So don't take objects out until you're absolutely certain they haven't penetrated any vital tissues that bleeding is going to be an issue. And if the horse is anxious and it's more of an injury, and offering them a little bit of hay or something is going to keep them quiet, that's perfectly okay. Choke. We kind of talked about choke. What you're going to typically see when a horse first chokes is food material coming out of the mouth and the nose. And typically it's going to be whatever they were eating at the time. And I've even seen horses choke on green grass when they've been very anxious and they grab more than they should and forget to chew before they swallow. In this situation, you want to make sure you remove all the feed. Give that horse a little bit of time. I don't, people talk about lunging them and things during this period of time. I just want them to be able to stretch their head, to cough, to snake their head. Some of them may even act a little colicky during this period of time and may lay down and get up, and call your veterinarian by all means, but a lot of times horses will resolve this. But if they have not resolved it in that half hour to hour we talked about before, you need to have a veterinarian come. And it's important because your horse is going to dehydrate. They produce several gallons of saliva on a daily basis. And especially if this is in the summertime, not are they only losing fluid from saliva, but they're also losing it from potentially sweating in a hot environment. And the more dehydrated your horse is going to get, the less chance he has of passing, this choke or being able to resolve it on his own. And just as a note, anytime your horse is tranquilized to have dental work done, to have a laceration sewed up, or what have you, it's very important that you keep this horse away from feed, grain and hay, until they're fully awake so they don't choke, because they will go to eating and forget to chew again properly and end up choking. And old horses that have poor dentition, and that may be a young horse, but typically an old horse, it's really important to make sure the feed matches their ability to chew and swallow. And if you have an overly aggressive eater, doing things to try and minimize the chances of them choking is important as well. If you have animals that get heat exhaustion and they're running a very high fever, you can go ahead and cold water hose them. You can put rubbing alcohol on them. to try and drop their temperatures, but remember to only drop them down to about 102, because even after you stop the alcohol or the cold water, they're going to continue to cool down, and we don't want to drop them into a subnormal range. And we're talking about horses here that have temperatures of 106, 7, 8, where we're starting to worry about different organs in the body starting to shut down. If they have a temperature of 104 or less, typically some of the medications that control fever, getting a fan on them, those are going to be sufficient, and having your veterinarian come out and look at the horse. But if they have an extremely high fever, then going ahead and doing some of these things to cool them, but don't cool them too cold. If you have a horse that ties up, and it may be from overexertion, or it may be some of the hereditary diseases, and so there's a whole group of diseases here where people will talk about in different terminology, tying up, and that may be just the overexertion, but it also may be some of the polysaccharide storage myopathies, used to be called Monday morning disease or azoturia. And rhabdomyolysis is just a fancy term that veterinarians use for muscle damage. And depending upon the severity of this is going to depend upon, what we do with these animals. If it's mild, you can just try, walking them and allow their muscles to kind of relax and stretch. If they are a little more, stiff, you may want to place them in a quiet, stall. But if this happens out on a trail or someplace and they're extremely painful, they're shaking, they're sweating, their muscles are hard, don't move that animal. Allow it to be there until the veterinarian arrives. And if these horses urinate, you're typically going to see a really dark kind of reddish urine, because what's happening is their muscles are getting damaged, and some of those muscle products are going into their urine and making the urine kind of look a red color. And it's very hard to tell with these horses when you see a red urine like that, is it blood or is it muscle damage? And a tying up horse is going to be muscle damage, but they look very similar to a horse that may have dark colored blood in its urine. Lamenesses, again, we talked about that. Keep your horse quiet. If it's a swollen area, you can go ahead and cold water hose it. If you suspect the leg to be severely damaged and potentially broken, do you want to bandage it or not, especially if you have to haul this animal? And one of the things in bandaging a horse is making sure that wherever you think the injury is, that you really stabilize the joint above and below the injury. So when you put a bandage on and a splint, if you think there's an injury on the right front cannon bone, you're going to make sure that that splint goes well below the fetlock and goes well above the knee, or what a veterinarian would call the carpus. Because if that bandage is allowed to slip, and typically if a bandage slips, now it's even worse than not being bandaged at all, because the bandage is acting as a pendulum and making that lower leg even more of something that swings back and forth and damages the leg. So unless you can get a really good splint on it, sometimes it's better off to not bandage it until somebody's there that's capable of putting a proper bandage on. Here's one that, no matter where you are in the country, you're going to see at some point in time, and hopefully not with your own horse, is diarrhea. And if you see a horse like the top picture where it kind of looks soft, it may even be a horse that's been getting a fair amount of grain, it stays above the bedding material or the dirt, that horse, if it's bright or reasonably bright, it's still drinking, it's eating somewhat, is kind of in that urgent category to make sure everything is going okay. But if you have the bottom horse here where it's literally painting the walls, and you can see the walls are stained, you can see staining in the shavings, but not really anything staying above the shavings, that's extremely important in the fact that this horse is going to dehydrate very, very quickly. And not only is it losing fluid, it's also losing electrolytes, primarily sodium and chloride. And this horse is going to need plenty of fluids, either orally or IV, depending upon the status of its intestinal tract and how functional it is. But along with that, fluid, it also needs electrolytes. So either, IV or oral electrolytes and fluids are extremely important, for this horse and its survival. And anytime we have a horse that has, severe diarrhea, we start to worry about its feet and whether this horse is going to develop laminitis or founder as well. HYPP, if you have horses that have, HYPP, placing them in a quiet, environment, giving them some, glucose or Karo syrup, and Karo syrup is glucose or dextrose. Horses that have behavioral changes, again, always keep rabies in the back of your mind. You want to have them in a safe, quiet area where they're not, being disturbed. And be careful when this horse has a behavioral change, they can be quite aggressive. And somebody had mentioned what is HYPP, and that's hyperperiodic paralysis, and it's a hereditary disease that we'll see, primarily in certain quarter horse lines. Impressive was a famous quarter horse stallion that first, had HYPP documented. Eyes, if you have a horse that has an eye injury, keep them quiet, keep them from rubbing it. And one of the things you can tell if your horse is rubbing his eyes is just feel the insides of his knees or his carpi. And if that area is wet, and his eyes have been tearing, he's further rubbing that eye. And there are, head masks and things you can put on, eye cups, that'll keep that eye safe while it is being treated or medicated or healing from a laceration or what have you. Because as, especially lacerations heal, some of these will get itchy with time, and just when it's at the most critical part of healing, they'll rub it and tear out the sutures. So there are things you can do to prevent, horses from rubbing their eyes. And, be aware of how to figure out sometimes if they're rubbing, if you don't see them, by just looking at the inside of their knees. So we're going to take the last few minutes here and talk a little bit about foals and foaling. And, foals are a whole different ball game than our adult horses. So all the rules and things we just talked about, where you can watch them for a period of time in an adult horse if it's kind of in that urgent category, goes out the window with foals, because they can change very, very rapidly, including the foaling aspect. Foaling in a mare is a very quick procedure, and something should happen every 10 minutes from the time you actually see the water. And if that foal is not on the ground in 30 minutes max, and they're usually a lot shorter period than that, something is wrong. And once they're on the ground, they should be up and able to stand in an hour, nurse in 2 hours, and mom should have got rid of her after birth by 3 hours after foaling. If these things don't happen, it's something where you need to have your veterinarian out there, because foals don't have a lot of reserve and they need attention immediately. One of the things during foaling that you want to really be aware of is red bags, and I have a picture on the next slide of a red bag, and it's where the whole placenta is starting to let loose before the foal is born, and so the foal is essentially suffocating inside mom. If that foal is not born in any situation within 30 minutes after you see the water bag or the birth fluids, then we start to worry that that foal may not be in a proper position. And if a foal is not repositioned pretty timely, it is going to usually result in the demise of the foal. And at that situation, we're trying to make sure the dam or the mare has the best chance of everything going well. And so if we don't have this foal out within a 30-minute max, it's extremely important that you get a hold of your veterinarian. If you're concerned about your mare and you're thinking she's getting close or something's not right, call your veterinarian, because it's like eyes. You don't have a lot of leeway time when we're dealing with a mare during the birthing process. So keep your veterinarian in the loop, and we're always here to talk to you on those situations. So here's a red bag, and what's happening, that this should have actually broke as the foal started to move up into normal position, and instead of seeing little feet coming out here, we're just seeing this kind of velvety looking material, and that's actually the mare's side of the afterbirth or the placenta. And the foal is right on the other side of this, and it's starting to become asphyxiated because it's not getting oxygen. The connection between mom and the placenta is breaking down. So it's important to get that baby out, quickly. You don't have time to, get your veterinarian out there. At this point in time, you need to open this. This membrane is pretty thick and firm, but remember, baby's on the other side. So you're not going to readily, break it with a fingernail. You're going to need, a scissors or a knife or potentially a nail or something sharp enough, but remember, baby's on the other side. If you have a malposition and you want to keep the mare from straining, get her up and walk her as you're calling your veterinarian. Get everybody together to help you in that situation, or line your trailer up if the mare has to go someplace. Because, as I said, a lot of times, unless it's something very simple, the foal may not be, delivered alive, but we're now, looking at, can we make sure that the mare, remains healthy and is viable for her next foaling. Foals, they are a little different. They're not miniature adults, and their temperature can go up a little bit higher on a normal rate, up to 102, maybe even 102.5 if they're out running around and playing. Their heart rates are going to be higher. They're going to be essentially, 2 to 3 times what an adult horse is. The respiratory rate is going to be higher. And a normal foal nurses many times an hour, and in between that they sleep. So what they do is they sleep, they get up, they stretch, they go to mom, they nurse, they may play a little bit, they urinate, and they go back to sleep. And if they don't do that, if they stand hunched up and they don't lay down, they're hard to arouse, they don't do that stretching, something is wrong. Because foals are pretty alert and excitable, very soon after birth. One of the things is that, any foal that is sick, then it's in the first couple of weeks of birth, is extremely urgent emergency type thing where you need to have somebody, take a look at them. They need to be nursing, they need to be urinating, they need to do all these things that babies do because they don't have a good, energy source they can draw on. They don't have a lot of extra, energy stored as either fat or glycogen to, carry them over a period of time that they may not be, nursing aggressively. And foals, because they are on a liquid diet, and if they're not nursing, their glucose energy supply drops rapidly, and they also, dehydrate very rapidly. If you look at the little foot and the top picture of this slide, what we see is a very soft bottomed little foot. And if you see a foot like this foal never stood. As soon as they stand, they, very quickly wear off, the bottom material of that little hoof, and it starts to look like a regular foot. That coating is there to protect baby, during the birthing process so that the uterus or mom isn't damaged. And if we have these little babies that are not acting right, being aggressive, getting care for them immediately often is enough to turn them around quickly, because even though foals can go downhill very quickly, with good supportive care, a lot of times they'll bounce back quickly. But if you look at them today at this hour and they don't look good, and you come back an hour later and they don't look good, it's time to be aggressive and get something done. Don't wait till morning. If you're handling foals, also, be very careful, especially if you're not used to handling foals. Make sure that somebody's holding the mare. You keep baby close to mom at the front end of her, and be safe, because again, mom, especially right around the foaling process, can be very protective, have a lot of maternal behavior, and she may not be comfortable with you around that foal, and especially if that foal, gets out of her sight. Anytime that you have a foal that's having a problem, try to get as complete a history, to your veterinarian as possible. Did the foaling, was it observed? How long did it take? Did the mare pass her placenta? When did you start noticing problems with the foal? What have you done treatment-wise with this foal, to this point in time, to, try and, make the best assessment of this foal possible. Finally, when the vet comes, you have all this information available to them. What's happened, how long it's taken, vaccination history. Remember that tetanus is very important when we're dealing with lacerations. Rabies is extremely important. They're two of the core vaccines. The other three core vaccines that all horses should get are Eastern and Western encephalitis and West Nile virus. Try to keep, that environment as safe as possible. Previous medical history of what incidents have appeared in the past. If it's a mare that's foaling, what's her previous foaling history? Has she carried foals to term in the past? Has she normally passed her placenta? And if you're going to have trouble remembering all this, make yourself some quick notes, because it's going to help when that veterinarian arrives. Also, if there's a potential of this animal going to a referral hospital, try to get a written history from your veterinarian. That's often just faxed up to the clinic that the animal may be going to, of all the medications and things, any test results that have happened in the past. It's going to make the assessment of that horse much better, having this previous history, and then getting that horse ready to transport. And practice loading your horses. The first time that it gets in a trailer after a number of years shouldn't be the time when it's on its way to a referral hospital, because again, that's just going to delay how quick you're going to be able to get it there. And if it's an emergency, you want to try and get that animal to the hospital as quickly as possible. So finally, prevention, is the key. Try to maintain that safe environment in all aspects. Try to treat horses as they're meant to eat much of the day. They do much better in a turnout situation if possible, and I realize that isn't always an option for the elite show horse, but try to do as much as you can to make it as stress-free and comfortable and safe an environment as possible. Having your mares foal in a situation where they're in a safe setting. Keep up on our preventive care that we kind of talked about, our dentistry, our vaccines, our deworming, and that goes, as parasite care now, not just deworming, all the things we do to minimize parasite ingestion. Keep up on your farrier work, and routinely look at your program and say, what can I do better? And again, remember, good observation. Even when you're rushing off to work in the morning and trying to get chores done, take 30 seconds and say, is my horse eating? Did he come up to the feeder the way he should? How's he standing there? Because we need to be really observant, and then again, trust your gut instinct. If your gut instinct says something is not quite right, then something isn't, and look further and try and figure out what's going on. And if there's any questions, I'm more than happy to answer those, as well as Dr. Schroeder can keep typing as well. But I'll start looking at the the chat box a little closer and try to answer any of your questions as well. And thank you very much for coming to tonight's presentation. Okay, there was a question about dipping foals, navels and feet. There's no reason to dip a foal's feet, and we've kind of moved away from dipping a foal's navel in strong iodine. A number of years ago now, and I hate to even think how many, there was a study in California where they looked at a number of different products, and the best product they found to control the bacteria around the navel was chlorhexidine or Novosan. And we used to say we want to use strong iodine and get that navel closed really quickly. Now we've changed our minds, as one saying that I really like picking up off of somebody's email is said, don't condemn the judgment of another because it differs from yours, because yours may not be right as well. And a number of things, as we progress, we figure out the things that we have done in the past may not be the best. And so no longer strong iodine. Now we want to use either a betadine, or in that California experiment, Novosan was the best to try and control bacteria around the navel. And you dip it multiple times a day until that navel, dries up. Does anybody have any, other, questions? And I see Dr. Schroeder just typed the same thing as I just mentioned. Well, if there are no more questions, I really, thank you very much for attending tonight. And, oh, here comes another one. And yes, there is, if you go to aaep.org, you can link up with the My Horse Matters. It's the client area in the equine practitioner's website, and they have that list for the first aid kit there. I didn't mention how long horses should be kept separate, or mare and foal should be kept separate from the rest of the animals, and that's going to depend a little bit on the mare and foal. And I see Dr. Schroeder is answering that one as well. But a maiden mare I would probably keep separate longer than an old campaigner who knows how to keep her foal safe and with her, versus a young mare that's just new to the situation. The question on deworming, there is no good amount of deworming now, and so much of it depends upon what hemisphere you live in, or I shouldn't say what hemisphere, whether you're in the northern part of the U.S. or the southern part of the U.S., as to when you deworm. And some horses may only need to be dewormed 1 to 2 times a year, depending upon management situations. Other horses, during the period of time when they're likely going to be infected, which in the northern U.S. is during the summer, in the southern U.S. it's during the winter, when the parasite larvae can mature on pasture, you may end up adding another 1 or 2 dewormings in that period of time between spring and fall. But the idea that every horse needs to be dewormed every 30, 60, 90 days is kind of going out of the window right now. And the fact that we need to look at these horses and determine for that horse in that management setting what's the best control for parasites. And Dr. Garcia and I did a parasite management talk for about 3.5 hours, and if you go to the Michigan State College of Veterinary Medicine website, it is actually there and has voice, just as this web cast has. And you can, if you're diligent and want to sit through the whole 3 and some hours of it, you can, and hear us talk about parasite control and actually have a few little case examples of why just picking dewormers and deworming on a 30, 60, 90-day schedule is not appropriate anymore. The other thing is the horse had has had a number of very, very good articles on parasite resistance. And one of them was a synopsis of a talk given at the American Association of Equine Practitioners this past winter. And it's well worth looking at. So if you just go to thehorse.com and type in parasite resistance, reading some of those articles is very, very beneficial. And I see Dr. Schroeder's made the comment here as far as the importance of fecals, because there are certain horses that shed most of the parasites. Are there any other questions?
Well, it looks like the questions are kind of slowing down, so if it's okay, I'll go ahead and read the conclusion, and then if anyone happens to continue to type questions in the chat box, then we can get to those at the end, if that's okay with you, Dr. Marteniuk.
That's
Okay.
fine with me.
Well, I especially want to thank you, Dr. Marteniuk, for your presentation this evening, and to Dr. Schroeder for doing a great job of keeping up with all of the questions. And we want to thank all of you for participating. Later this week, you will receive an invitation by email to participate in an online survey about tonight's webcast. So if you could just take a few minutes to give us your feedback, we would really appreciate it. And next month, My Horse University and HorseQuest will offer a free webcast on the topic of parenting tips at the horse show. And if you didn't already know, My Horse University is now on Facebook, so become our fan to get the most up-to-date information on our events, courses, and more. And again, remember that this webcast was recorded and will be uploaded to our website by the end of the week. You can send us your comments and suggestions to info@myhorseuniversity.com. And thanks again, and have a great evening.
Rihanna, if you're still there, I just seen you, type a question of why your horse has a runny nose this time of the year. And just like people, a number of horses may, be affected by some of the allergens, depending upon where you live in the country, or maybe, even outside of the U.S. Quality of feed, this time of the year, feed may be more, dusty. If you're having, dry weather and dust is flying, just irritation, can be a problem. So there are a number of reasons why your horse has a runny nose. And if it's just a clear, a little bit of discharge, looks more watery, not something to be concerned about. If it is a little bit, off color, but your horse is still eating and drinking, then maybe we're thinking more of some kind of reactive airway disease or heaves. But if that discharge is very foul smelling and there's large volumes of it, it's very important you have your veterinarian take a look at it. There's another question came in on clover slobbers, and typically this does not cause dehydration. But if you have horses that are left on it, typically when we see this, we recommend you take the horse off because it's associated with a mold on the clover, and mow the pasture or whatever. And as the environment changes and we get more moist or drying to that pasture, it's no longer a problem. Clover slobbers can be found in hay as well. And so it's important that if you have hay that causes them to have that drooling Pavlov dog type salivation, that you change your hay as well as taking them off pasture if it's a summertime issue. So again, it looks like most people are logging off, and thank you very much. And at any time, if you have any questions, always contact your veterinarian, or we are always there to lend a hand at calling your university. And most places that have a college of veterinary medicine will have somebody that will return your call and try to answer your questions. And the one question here on how long would a horse have to be laminated before concern of rotation of the coffin bone, it can be a matter of hours. The one thing about laminitis or founder, there are no set standards, and just being extremely painful for a very, very short period of time can have an extreme amount of damage done to the hoof wall. And you're going to see, you know, the coffin bones sinking in that hoof capsule. So no set standards. Main thing we want to do is keep that horse quiet, provide support for its feet, try to get them on pain meds, get your veterinarian and farrier involved to try and stop the pain cycle and stabilize the condition. But and it also depends upon why the horse is developing laminitis or founder in the first place. And the nice thing you can see is Dr. Schroeder and I agree on most of our answers. Basically all of our answers. We just, one complements the other.
Well, it looks like that takes care of most of the questions, so I just want to say thanks again, and hopefully you will join us next month.
Thank you very much, everybody. Have a good evening.